Now, I'm just going to show you a drug here. If anyone has to have chemo, particularly high dose chemo, or a thing that's great for stopping you getting neutropenia is growth stimulating factor. Not a difficult drug to inject yourself. It's really, sounds horrible injecting yourself if you're not diabetic and used to it. It's actually really easy because you've got hardly any, what do you call it? Nerve endings in your stomach. Fat basically are fairly devoid of nerve endings, so although it looks scary, plunging a needle into it almost doesn't feel, you don't feel anything. I've had huge needles that I've had to inject myself with, or my husband has actually. I was a bit chicken, but you actually don't feel it at all. So just remember that if you're having chemo yourself, to ask or consider growth stimulating factor. It does make you feel a bit fluey, but it can prevent a lot of the really awful side effects of high dose chemo, like really disgusting mouths. I actually looked a bit like a lizard once, and I had, my bone marrow was just a mess, and it stops your bone marrow plummeting quite so low, which has big consequences. It means you're not nearly as susceptible to infection. All sorts of things like that. So anyway, I'm going to show you how to do it in a second. Stop this for a second. Okay, demonstration. How to give yourself an injection. Really, it's not hard. You take your syringe. Sorry. You take it out of its top, like that. And you find a bit of you that's basically fatty tissue, which has no nerve endings in it at all, and somewhere where your skin doesn't have many nerve endings either, which means basically it's painless or very close to painless. You might hit a tiny nerve, but even then it's like grazing your hand on an iron scouring pad or something. It's about as painful as that. So I'm not going to show you my very white and pasty tummy. Not very fat at the moment because I've not been eating anything. But it's not a beautiful sight, I can assure you. But I'm going to show it to you anyway to show you what to do. So fast is good. You grab a little bit of your tummy. You go just straight in, or you can do it at an angle. Like that. Doesn't. I actually couldn't feel that at all. And then you just inject the stuff in. Now this is quite a lot. Mostly it's quite small amounts. I can barely feel that. I can feel this slight pressure and a little bit of stinging from the fluid itself. But as you can see, I went slowly to show you, and really it's a nothing. That's useful to know because people really dread giving themselves injections and make appointments with their GPs to do it, and I don't know, faff about quite a lot. It's very easy to do it to yourself, and if you can't stomach that, pardon the pun, you can always get your husband or loved one, whoever happens to be about, your partner, your child can do it, anyone can do it. Yeah, you can see how easy that was. So if you have to have chemo and you have to have injections, later follow-up things, don't be afraid to just do it for yourself or save yourself a trip to the doctor. Don't know if that convinced anybody, but it is true. Okay, that's enough.